Hey everyone, today I am doing a little bit of lip filler and then a little bit chin filler on this wonderful patient. She naturally has a really beautiful lip at baseline. She has a really pretty shape at baseline, a nice cupid's bow, a full pouty bottom lip, and she really didn't want all that much. So as you can see, I'm using the AAFE right angle technique and spreading out my vertical struts a little bit further than I would if I were really kind of starting with someone that had a smaller lip or lacked shape or definition to begin with. So you can see I've backfilled into 0.5 cc ComfortTalk syringes because this allows me to limit the amount of filler that I'm pushing as I am delivering the product. And it's also through a 31 gauge needle, which tends to be way more comfortable for the patient. You can also see that this technique, the needle, I'm keeping it more superficial than maybe I would if I were using the normal filler syringe. And that's on purpose. We're trying to give her as much pickup, as much height or show of the lip as possible. I'm using I would say a medium-ish type filler. One that's very natural appearing, easy to massage in the lips, sits really well. And for her, because she has such a beautiful shape at baseline, I'm really just enhancing that natural shape so I can use a product that's a little bit more fluid-like. She does like her peaked cupid's bow, so I definitely maintained that. And then her bottom lip, as you can see, is already really kind of nice and pouty. So I'm just going in and doing some standard volumization in this area and filling in the lip accordingly. Still through backfilled ComfortTalk syringes, just because I find that it's more comfortable for the patient. Is it more pokes? Yes, but those pokes are way more comfortable than if I were going in with the normal dermal filler syringe. She is someone that has had lip filler in the past, but it's been almost 3 years actually since she's gotten her lips filled. So as you can see, her baseline lip is really nice, and she probably does still have a little bit of filler in there from last time, even though it's been years. Filler tends to stick around a lot longer than the manufacturer says. So definitely still has a little bit of filler in her lips, and at baseline has a decent sized lip to begin with. So now I'm just kind of, once I've gotten filler everywhere, I'm just kind of looking and seeing where I think she needs more. So she just needed a little bit more pick me up on that right side there to kind of match the left. I always try to make patients as symmetrical as possible. With that being said, I also set realistic expectations with my patients because we are all asymmetrical at baseline, and we're not miracle workers. We can't always make patients perfectly symmetrical. So make sure that you set those expectations with your patients as well. Once I kind of got filler everywhere, I then went in and just massaged everything to make sure that it all feels good, no major lumps or bumps. And then I always look at the patient straight on while they're sitting up nice and tall to assess and see, if I want to be nitpicky and try to enhance areas that I can. We had a little bit of filler left over, and she has used it in her chin before in the past and really liked it. So I decided that I was going to do that. So as you can see, I was using the Wave FE ultrasound just to ensure that everything looks good. Just an added safety measure because the chin can be more of a high risk area. So I definitely always ultrasound the chin before I inject it. And then I am going straight into the medial chin area, straight down all the way to bone, making sure I'm doing a good aspiration. I usually will hold it for a good 6 to 10 seconds, make sure there's no positive blood in the hub of the needle, and then delivering no more than about 0.1 cc of product in each bolus. You can see I'm not doing much because she honestly has a really nice chin to start, and I'm going to be toxing her chin as well to help with that mental crease and kind of relax that muscle a little bit. So that will also help with elongating and projecting the chin as well. So I only did just a little bit in that area. Even though I did just a little bit, I still always end with a massage and make sure things feel good, nice and smooth, incorporated into the tissue as best as possible. And then I forgot to grab her lip kit for her, so this was kind of after the fact, but going ahead and putting on her post-care lip kit, and that is it. Thank you so much for watching, everyone, and I'll see you in the next one.